Hello and welcome to the Week 1 wrap-up. This is your instructor, Carissa Delkey. So in Week 1, we got to discuss ethics of drug development for geriatric patients, and I mentioned this in the live lecture for Week 1. Pretty much the biggest concern we have is the cost associated with it. They are trying to come up with therapies to help stop the aging process. They've actually had some success with that, with actually working at the genetic level to help work on the epigenetic factors, which is the methylation of the actual genes, which causes them to turn on and off, to actually help to turn off some of the genes that are associated with the processes of aging. So like decreased collagen production, decreased cellular reproduction. So basically your cells are not copying themselves as frequently. So they're working on a lot of that, but really the goal of a lot of the research is to help find treatments that better treat illnesses that occur as patients age. As we age, as you found in Chapter 3, there's a lot of different things that come into effect. So decreased cytochrome P450, decreased kidney function. So the metabolization of drugs can actually lead to a toxic effect more quickly. Also, patients have trouble eliminating the drugs. They also have problems with blood-brain barriers, so medications working too well sometimes. So there's a lot of different things a lot of different factors that come into play when it comes to geriatric patients. So they keep doing research to try and find better treatments to help ward off or to help stop diseases that are common as we age. So for instance, hypertension, diabetes, a lot of different forms of cancer, Alzheimer's. You can also have anxiety, depression, those type of things. So they're continuously doing research. And I saw some students were not in favor of it, but I think that they were taking it from the aspect of patients not being involved in the care process. Whereas you do have to have informed consent to be able to, and basically patient autonomy when it comes to research. So most of the time, it's the geriatric patient themselves that are signing them up for research. But you can have family members that are, if they're a medical power of attorney, then they can sign them up. But that's a little bit more rare. That's for conditions typically that are a little bit riskier, so they fall into like the Orphan Drug Act or that type of thing. So overall, really good work, really good research. I was happy to see a lot of awesome research on behalf of most students. If you didn't do research, please keep that in mind, that is a requirement for you to complete research as part of your discussion participation. Now, using the textbook is great. That's great supplemental material, but you should be performing research outside of that as well, and performing research on the topic. So just keep that in mind. If you have any questions, definitely see the writing lab for help, or you can definitely take a look at the video I created in my discussion announcement. Now, we also covered chapters 1 through 5, so I did cover as much as I could in the live lecture, which actually ended up running over, which it always does. But if you have any questions about the material, especially when it comes to basic pharmacology, to basics of calculations, to geriatric patients, any of those, please let me know, and I'll be more than happy to help you with those. Please note that late work can only be accepted up to 1 week from the initial due date. With a break, that puts late work at 1/7/17. The assignment, if you remember from the live lecture, I showed you how to do the assignment. You're basically downloading the worksheet from the readings and materials section, and then you're just using that as a guide as you read through the chapters, and then you're filling that out basically in Canvas when you're done with it. So use that. I have one for week 2 as well, because that'll help you better understand the material, but it'll also help you to reinforce the material as you read through the chapters. Now in week 2, you have a break from 12/19 to 1/1, so you will be on break for the next 2 weeks. So keep that in mind. You don't have to log in, but if you want to, you can. Actually, if you want to log in, you are welcome to. They're actually doing some types of raffles and prizes. So if you are interested and you want to participate in the class during that time, definitely take advantage of that. I will be on vacation from 12/22 to 1/1, so I won't be available for general participation within the class because we are on break during that time. So if it's an emergent need, you are welcome to text me. I won't be responding to my emails because I won't be monitoring my emails. They will actually have an out of office that refers you to Student Success Center or to the dean for that. So in week 2, we're going to be discussing Botox, so start thinking of that. But it's very interesting because Botox, from the discussion standpoint of ethical implications of Botox, but it's used for a lot of other things besides facial wrinkles. So do your research on this one because you're finding a lot of cool things. Just be careful with opinion sites. Try and stick to only drug fact sites because if you start going to opinion sites, it starts to get a little scary with the information because once we just focus on opinion and not so much on actual research, it kind of can stray your view away from the actual facts of what it's used for, that the actual safety rate is less than 3% of those who receive the injection have some type of adverse effect. Less than 1% is a serious adverse effect. So it's a very safe drug that is used. So just keep that in mind when you're researching it. So I hope you guys have an awesome holiday season. However you celebrate or don't celebrate, just enjoy this break. Enjoy this time with your family. If you need to get ahead because you know the first week in January is going to be rough for you, go ahead. Go ahead and get ahead in the course. Week 2 is open for you to participate in and to start working on your chapters. This will just give you a little bit more time to do it. So have a wonderful 2-week break, and I will see you in 2017.